I'm Erik Thompson. I have 2 grants with NBCF. I have a national collaborative research program called Empathy, and I also have a pilot seed grant to look at circulating tumour cells here. The reason I decided to work on breast cancer was really serendipity. I did always have a strong desire to work on cancer. Now, of course, I have much stronger links with breast cancer, and my mother has had breast cancer. But at that time, I joined the National Institutes of Health in the USA. They had a breast cancer program of research going, and I started working with them, and I've never looked back. That was over 30 years ago. Once metastatic breast cancer is diagnosed, I think most women realise that this is going to be a tough road. So this obviously brings a lot of different emotions. We're always getting new advances in our ability to understand about metastatic breast cancer, and this is obviously what we're working on. But the problem with metastatic breast cancer is our current therapies really don't work well on metastatic breast cancer. We don't have the advantage of being able to remove it easily or to use radiotherapy with it. So we rely on chemotherapeutics, and most often the cells have become resistant to the established therapies. So very, very difficult to treat metastatic breast cancer. Our work with circulating tumour cells is really devised to try to give us a window into the metastatic disease. We can access the cells from the blood and study them and have some idea about the molecular processes that the cells in the metastases are using, and hopefully develop new therapies. Our particular project is to do with a process called epithelial mesenchymal plasticity. This is used in the developing embryo to help cells move around and create new tissues and new organs, and very much akin to the spread of cancers. And we've evidenced that breast cancers use this process to spread. So we're really trying to understand how this process is regulated in a breast cancer setting, and to what extent it is being used in the metastatic process, and then to understand, using circulating tumour cells, for example, how we may be able to effectively combat that process to achieve some new therapeutic angles against metastatic breast cancer. The research that we're doing has enormous potential if we are successful. If we can make metastatic disease amenable to some of our current therapies, if we can retard drug resistance, which we currently see, if we can develop new therapies to block the survival and the growth of these cells in the metastatic site, we can take the problem of the metastatic disease burden away. So, of course, this is highly aspirational, but those are our goals. And if we're successful, of course, that would have a huge effect on women with metastatic breast cancer. The biggest challenges for anybody researching breast cancer or researching anything is money, I'm afraid. We having enough resources to invest in larger undertakings, and more collaborative, interactive, optimised undertakings such as we have with the National Collaborative Research Program. This allows us to sort of move forward with confidence and look for bigger outcomes. So money is really the biggest factor. The other thing that's really good about NBCF is the large portfolio of different types of grants that they offer. So in particular, I've emphasised the multidisciplinary national collaborative research programs, but NBCF offers all sorts of grants for all sorts of individuals at all different levels, and this allows us to develop a much broader platform to achieve success. I would say that the biggest breakthrough for breast cancer research that I can think of was the discovery of the important role of estrogen receptor. And this predated my involvement, not by too long, but it's about 40 years ago. that, it was clear that ER played an important role, and this led to tamoxifan's becoming such a successful drug, and other estrogen receptor antagonists or aromatase inhibitors. In my particular career, it's been terrific to see the HER2 receptor. I was at the conference when they first discovered and talked about discovering HER2 amplification back in 1987. I saw that it took 10 to 15 years for that to mature into a viable therapy, which now offers so many women such an incredible treatment option for what was otherwise a very, very aggressive form of breast cancer. So we have seen, this molecular medicine approach come through my career, and obviously the new personalised medicine approaches with genomics that allow us, I think, in the coming years to be much more effective in helping so many more different women. The breakthrough that I attribute the most in my career is the observation of the importance of that epithelial mesenchymal plasticity change, and we saw that very early on. It was in the shadows for a long time, and then it was shown that this had a lot to do with breast cancer stem cells, the cells that can form new tumours that have the drug resistance and that allow metastatic deposits to grow. And this was explosive in terms of my career, and we had been looking at this from very early on, and we're very gratified that this has become a major approach to breast cancer research and other cancers as well. The aspirational goal of zero deaths in 2030 is, I believe, a very credible aspirational goal. It is actually possible to think about understanding the process of breast cancer well enough to detect it very early and to eradicate it quickly. It may still involve surgery to some extent, but it should, I think, lead us to a situation where we have a much, much lower chance of recurrence and metastasis and death. I think it'll take some transition, so even if by 2030 we could stop all new breast cancers from forming or growing, we would still have a period of time when pre-existing cancers that have been diagnosed before that may result in metastases, and so we still need, I believe, to work very hard to understand the mechanisms of metastasis. I would absolutely like to thank our donors and supporters so much for their critical support for the breast cancer field, and also to say that we are so lucky that we have NBCF to organise and coordinate that in such a creative way to allow us to have very effective research into breast cancer.